Homicides in Louisville so far this year, a trend many would like to see change.
WDRB's Darby Bean breaks down the violence month by month. Darby?
Guys, coming off a year of record homicides, this January started off with 16. Last month, there were 9 reported, and less than 2 full weeks into March, 8 homicides. This amount of lives lost is similar to the same time last year.
It's hard to call it an increase given the last couple of years. I mean, it very much feels like a continuation of what we've experienced over that 2-year period.
Following 2 straight years of record homicide numbers in Louisville, this year already more than 30 in less than 3 months.
The first 9 days of March is a stark reminder that, we're not into that serious tick down that we constantly hope for.
Homes, public parks, a convenience store surrounded by crime scene tape this month. Another homicide in the city. Police responding during the day and at night.
Gunshots are still going off in neighborhoods far too often than they should be.
Christopher 2X with the Game Changers organization says there have also been more than 80 people shot and wounded this year in Louisville. That number is down some from last year according to LMPD data. But surviving doesn't necessarily mean life goes back to normal. Just ask trauma surgeons like Dr. Keith Miller.
That can mean physical injuries like never walking again, never eating on their own again, being on a ventilator for the rest of their life.
He says the trauma unit at U of L has the capacity to handle the volume of patients it's seeing, but there are concerns outside of the hospital's control, like the nationwide shortage of blood.
When there are shortages, it absolutely impacts what we're able to do in the hospital.
Activists like 2X say there are several reasons for shootings, anything from handling disputes with a gun to revenge. He and Miller are working with kids in the Future Healers program, hoping to make a difference and prevent injuries down the road.
The inspiration for everybody to keep working on the problem should be the kids.
In Louisville, Darby Bean, WDRB News. Dr. Miller is asking anyone who can and is willing to give blood as that shortage continues. Darby Bean, WDRB News.